Now let's identify the primary determinants associated with fentanyl-detected deaths. The determinants of a condition, such as fentanyl-detected deaths, is any factor that is capable of bringing about change in the health status of a population or that is associated with an adverse health outcome. These determinants can be classified as biological, social, cultural, economic, and physical factors. While fentanyl-associated death is contingent upon the ingestion of substances containing fentanyl, there are social, behavioral, and environmental factors that increase the risk of this adverse health outcome. A study conducted by Amlani et al. Analyzed determinants of fentanyl detection in participants in British Columbia, including the number of substances used, regional health authority, age group, and gender. The Regional Health Authority of Island Health had the highest odds of participants testing positive for fentanyl, with 3.6 times the odds than the Reference Health Authority of Vancouver Coastal Health. The odds of detecting fentanyl in the urine of participants from Fraser Health Authority, the Regional Health Authority with the highest incidence proportion of fentanyl-associated deaths in 2016, was 1.26 times greater than the participants from Vancouver Coastal Health. Conversely, Interior Health Authority had the lowest odds, with 0.4 times the odds of detection of fentanyl in the urine than Vancouver Coastal Health. Analysis of the number of substances used, age group, and gender did not reveal statistically significant results in this study. A literature review identified factors that increase opioid-related mortality in the United States and Canada over the past 2 decades, identifying 3 broad areas: prescriber behavior, user behavioral characteristics, and environmental or systemic determinants. Prescriber behavior that facilitates the prescription of more opioids, the prescription of higher doses of opioids, the prescription of higher volume of opioids, and the prescriptions of specific drugs, oxycodone and methadone, increase the availability of potent opioids. User behaviors of diversion, pharmaceutical shopping, polydrug use, or drug substitution, and user characteristics of sociodemographic characteristics or drug abuse history increase the individual's risk of death due to opioid use. The general findings were that opioid-related mortality was increased for the sociodemographic characteristics of male, non-Hispanic whites or American natives, middle age, rural residency, and lower socioeconomic status. The identified environmental and systemic determinants that influenced opioid mortality were guidelines or policies, socioeconomic status, and interventions. The introduction of legislation that introduces warnings based on prescribed opioid dose was followed by a decrease in opioid-related mortalities. High income inequality within a region has been correlated with increased opioid-related mortalities. Introducing overdose education and naloxone distribution programs in targeted communities has reduced the incidence of fatal overdose cases. Finally, a Canadian study on opioid use identified 4 factors that increase the mortality of opioid use: mental health problems, chronic pain, unstable housing, and criminal justice sanctions. Identification of these determinants that increase the risk of fentanyl-associated deaths in British Columbia is key to developing appropriate public health interventions.